Morning, everybody. First of all, some thanks to Dr. Gary Kearney, also to Safefood and Food Standards Agency for the opportunity to come and speak to you this morning. This is a very important area. I know as a broadcast journalist, then as a victims commissioner, and now as an MLA, a constituency MLA, this is a really important subject. My constituency office is in Newton Ards, and we give out vouchers for the Ards Food Bank. And what I've noticed in recent months is the change in the socio-economic profile of those who are coming forward and looking for those vouchers. People who hang back if they see somebody is in the office because they don't want to be seen to be coming in to ask for a voucher. And in the 21st century, a quarter of the way into the 21st century, in a first world country, we'll have to ask ourselves, is that really the way we want to live our lives? So since I was appointed as health minister, I have become almost obsessed with the idea of tackling health inequalities. And for me, that's a shorthand. It's not just about outcomes, it's about equitable access, and it's also about health literacy. And while clinical and medical interventions can help tackle health inequalities, the research we rely on suggests that only accounts for about 20% of what needs to be done. 40% is socio-economic, 10% is to do with the environment, and the remaining 30% is about behaviours, choices that people make. So on that basis, it is and has to be a whole executive initiative, and I've mentioned this to executive colleagues, and I think there is an appetite and a willingness to try and shift that dial on health inequalities for the first time since devolution was introduced back in 1998. So with that in mind, it's very clear to me that food poverty is an outcome of the wider inequalities and inequities that exist here in Northern Ireland. Now, we have a health survey. It has regularly asked questions relating to food poverty, and it shows that food insecurity in households has risen significantly in the period between 2013-14 and 2022-23. So there's no doubt in my mind this issue is having a real impact on people's mental health, their physical health, and on their sense of well-being. And alongside the health inequalities faced by those experiencing food poverty are concerns about communicating the complexity of the issues and the stigma surrounding it. And for me, stigma equates to a prejudice. How we talk about food poverty really, really matters. So I believe there's real value in establishing a shared language which takes account of the complexity of food poverty and keeps the emphasis on effective and non-stigmatizing solutions. It's vital, in my view, that we consider this and ensure that our language across service providers, policy documents, media and society does not add to that stigma and further marginalize people who may be vulnerable or at risk of food poverty. And while the Department for Communities here is the lead on poverty generally, my department currently has an obesity prevention strategic framework. It's called A Fitter Future for All, and it has specific outcomes relating to food poverty. And we're in the process of developing a new obesity strategic framework, but in line with our current strategy, working with stakeholders to tackle food poverty will be an important part of the new strategic framework as it progresses. I'm also pleased to see that the draft programme for government references work on the development of a Northern Ireland food strategy framework led by DAERA, the Department of Agriculture, Environment and Rural Affairs, along with initiatives like the Food Action Plan. These recognise the interconnectedness between food, health, the economy and the environment. In other words, we're determined to get out of our departmental silos and deliver joined-up government for you. I'm also committed to ensuring children and young people get the best possible start in life. An important part of this is supporting families to make healthier choices. The Healthy Start scheme, which is funded by my department, provides financial support to low-income families with children under the age of 4, and that's aimed to improve their access to healthy food. The scheme provides a financial contribution towards the purchase of fruits, vegetables, pulses, breads, and indeed milk. And it also provides a contribution towards infant formula for young infants. The scheme currently helps around 11,000 eligible households here in Northern Ireland, and it works to further promote and raise awareness of the scheme to eligible families, and that is underway. Officials from my department have long been active members of the All-Ireland Food Poverty Network, and they're committed to continuing this important collaboration, supporting and progressing work with partners and stakeholders within the network and beyond to reduce food poverty and increase access to healthy, nutritious food across our island. So, in conclusion, I want to extend my thanks to the speakers for bringing their expertise to this important discussion this morning. I'm afraid I'm going to rush off now. I see a former minister in the room, Alex Atwood, who's very welcome. I think he'll understand this. As a broadcast journalist, I never understood why politicians turn up late, leave early, or just cancel altogether at short notice. But believe me, 3.5 months into the role, I understand perfectly. Have a great day. Thank you so much.